The Coffee Hour Peer Support Program provides NICU mothers an opportunity to give back to other NICU mothers. And in that way, they can be supportive to them while their baby's in the NICU by giving them advice on things that helped them while they were in the NICU.
I have 2 boys on the autism spectrum. The Bucks County Admirals Special Needs Ice Hockey Team is the really perfect social group and organization to meet their needs to play sports, to learn about teamwork, and to do a lot of different things and get them ready for life, basically.
We started the team 8 years ago because we are a hockey family. My son plays, I play, and my older son, who's special needs, always used to come watch the games.
We've developed this health fair to help screen men for high blood pressure, sugar diabetes, for prostate cancer. And the most recent fair that we have, we initiated the new American Heart Association risk score, and the funding from the CARE grant helped us purchase reagents to do the testing needed for this calculation.
My project was the Affordable Care Act enrollment campaign. We saw the need to enroll citizens or community members from West Philadelphia and Southwest Philadelphia to have better access to health care.
Broad Street Ministry is a nonprofit organization that works to help folks experiencing extreme poverty stabilize their lives.
Many of the clients at Broad Street are challenged with health care. They don't necessarily have a regular provider. So there's actually community workers that come in and do health screenings. We are able to provide for them some things like blood pressure cuffs, as well as even as simple as toiletry kits, just to really provide basic hygiene kits for the clients.
One of the great things that people need is a permanent place to live. Mary Ellen Graham, the founder of our project, started a program called My-Place-Germantown.
I coordinated the West Philadelphia Wellness Empowerment Program, which was a healthy eating, healthy cooking, and food access program based in Mantua.
The unfortunate thing is that Mantua is an underserved community where there is not easy access to fresh fruits and vegetables. And so the idea of being able to bring not only this type of education to the community, but also resources and fresh fruits where people can afford them and get easy access to them is something that's so needed.
We work with this high-risk, really fragile infant population, and they are premature infants, so they're at a higher risk for dying of SIDS, sudden infant death syndrome. So we're looking at ways of preventing that. So we applied to get sleep sacks to be able to promote safe sleep in our unit. It kind of evolved into us giving out the sacks.
We evaluate the patient. The patient come in, have a problem, and then we decided the patient should go to the regular clinic or go to the emergency to be evaluated.
Asians had the lowest access to mental health care. Stigma is a strong barrier to care, and it's pretty prevalent in the culture. And I think the only way to address it is by talking about it and doing community outreach and educating the population. We've done 2 community outreach talks, and they've asked us to come back and give more. And I'm really appreciative of the penn-cares program. It's really great to have the institutional support and backup. That way you don't feel like you're alone in the community trying to help people.
I think even though the grants and the scope of a lot of foundations may be relatively small, I mean, they can make a big impact. It was a significant share of the funding that we need to support our personal hygiene program, and so it did have a big impact.
They're serving a very vital function because they give many small grants to small nonprofit organizations, and it's a very hard time for the small nonprofit, and they're filling a very needed gap.
It's just really allowed us to do something awesome.